Jeyhan was the only person I worked with that could de-epithelialize faster than me. She would smoke me.
So she's a better surgeon, is what you're saying.
She had these wicked little hands. Like,
gee, that's not saying a whole lot, but I know she's amazing, but it's not saying a whole lot that she's just slightly better than you, right?
no, I'm serious. She's good.
Welcome to HKB Uncut, the health, knowledge, and beauty podcast.
On this show, we unpack the newest techniques and trends in cosmetic surgery, how to tune out the social media noise to make empowered decisions about your appearance, and what you need to know before you book a procedure.
I'm Dr. Bill Cortesas.
And I'm Gaurav Bahardi. We are board-certified plastic surgeons and co-founders of HKB Cosmetic Surgery, an award-winning practice with 11 locations across 6 states.
In other words, when it comes to aesthetics and cosmetic surgery, we've pretty much seen it all, and we want to share our knowledge and unique approach to aesthetics and beauty with you. Whether you're interested in cosmetic surgery for yourself or want to separate fact from fiction in the plastic surgery world, we hope you'll tune in each week.
All right. Well, we are so excited to have the incredibly talented and lovely Dr. Jeyhan Wood with us today from Chapel Hill. Jeyhan, it's so good to see you.
Good to see you guys.
Thanks for being here, my friend. We've known Jeyhan for a long time.
Jeyhan, almost 20 years.
It's insane.
Is that right? I mean, am I
there's
wrong?
no way
Am I
because
right?
she doesn't look a day over 30, so we could not have met her when she was 10.
Jeyhan was many years junior to you.
True.
A little junior
True.
to me.
Yeah.
You know what the thing about Jeyhan was? Jeyhan was the only person I worked with that could de-epithelialize faster than me. She would smoke me.
So she's a better surgeon, is what you're saying.
She had these wicked little hands. Like,
Gee, that's not saying a whole lot, but I know she's amazing, but it's not saying a whole lot that she's just slightly better than you, right?
no, I'm serious. She's good. Like, and I'll always learn one thing: you don't mess with the Jeyhan. Like the Zohan, don't mess with the Zohan. You don't mess with the Jeyhan. And I never actually did, but Jeyhan is like in the OR. Was so talented.
I love it.
Thank you.
I never really got to operate with her that much. We were only there together a year. So what we're talking about is we all trained together at Wake Forest. And then you went to work in Chapel Hill.
Well, she did a fellowship.
And then
Craniofacial fellowship.
And then you went and work in Chapel Hill at the hospital, and then been with us now year and a half?
2.5 years.
2.5
years.
2.5.
Oh my
Yeah.
goodness.
Time
gracious.
flies.
Time flies. Can you talk a little bit about that transition?
Well, yeah. So it was just kind of the right time in my life and with my family and where I was at this stage in my career. I actually missed cosmetic surgery. I was mainly focusing on pediatric plastic surgery and complex facial trauma. Loved that, but I was still missing doing, aesthetic surgery.
Mm-hmm.
And so I really was grateful for the opportunity to renew this skill set. And I've really enjoyed this transition so far, and it's been a really fulfilling experience. One of the great things is I'm still actually able to operate on some children. So like some of the families have followed me over, and I've done some cleft rhinoplasties and fat grafting to the lip for some of my cleft lip patients. And I've done several setback otoplasties for kids with prominent ears. So it's been great.
That's amazing. And the complexity of what you have dealt with, and the incredibly difficult kind of fine-tuned surgery you've done with like cleft lips and palates and redo things. It's interesting how those things help and bring you to this point where you're at now, where how many things do you do now like you did like when you were like we trained right back in the day coming out of Wake? I mean, when I talk to Bill, it's like we don't do anything that way. Not because it was wrong. It's just because we've evolved and learned so much. And like in regards to you and how you approach like a neck lift now, like all those complexities that you did and those difficult noses, those difficult cleft lips and palates, like all of that has led you to where you can now perform at the level that you're performing at,
Yeah, I agree. I mean, I think there's a ton of overlap between craniofacial surgery and aesthetic surgery. From in principle and techniques. And I use a ton of the principles and techniques that I've learned over the years operating on kids and complex facial trauma patients that I'm able to implement now in the cosmetic realm. Like, for instance, doing complex facial recon, I never knew what I was walking into sometimes. And, I had to piece things back together, bones, muscle, all the soft tissue of the face. And so I think that gave me a really deeper understanding of facial anatomy that I can then, use when I'm doing facelift surgery, neck lifts. I used to put tissue expanders in kids all the time in their cheeks, necks, scalps. It's the same concept of breast reconstruction, but I would essentially try to expand up the skin so I could take out some significant scarring, or, if they had a birthmark on their face or neck. And so I'm very familiar with all those soft tissue planes.
What is your preferred approach for facial rejuvenation if doing a facelift?
I mean, I like a deep plane facelift myself. I think that it offers really great lift, great longevity in the rejuvenation.
What are you doing in the neck?
In neck lift patients, I'm doing central like platysmoplasty, and then laterally I'll do a little sling to kind of give them some more definition along the jawline.
And what is your opinion on, when you're doing necks, or is it just a traditional kind of retroauricular behind the ear incision line approach, or are you doing any kind of different approaches?
Yeah, so certainly that's the majority of my patients will have the standard approach, but I've been seeing a lot of men recently who are interested in neck lifts, and with them, you can offer them a direct neck lift approach, which is essentially making incisions in the center part of the neck to really get down to the anatomy. I'll do my muscle work and everything, and then take out the extra skin in a Grecian urn fashion. So they end up having two horizontal lines and then a straight line down the middle. But this skin is so much thicker on men and hair bearing, so you're allowed to make those scars on the neck, and they just blend in over time, especially if a man wears a beard.
It's a pretty powerful operation to be able to do that. I've done quite a few myself, and I'll tell you, the patients are extremely happy, and they don't realize how easy it is. They're like, "Oh my God, this is gone," just like that.
It's amazing.
And that's
it's one of my favorite things.
You're doing general anesthesia, local anesthesia, wide awake. Which way are you doing it?
So either way, whatever the patient's comfortable with, but I think a direct neck lift can certainly be done with just a little bit of oral sedation and local anesthesia.
Oh, it's so awesome.
It's a beautiful procedure.
That is
so for men who are interested, let's talk about that a little bit, because again, I've done quite a few. I know, G, you've done quite a few as well. What's the recovery like for them? Let's just talk to, I know there are a lot of men who are listeners and wives that are listening. They're going to go home and tell their husbands, "Hey, by the way, do you know you can get this taken care of with this?" Walk us through the recovery of that procedure.
Yeah, so the surgery takes about an hour, maybe an hour and a half. And then I don't need a drain. I use stitches that need to come out in a week. So I'll see you back at a week. It's an outpatient procedure. The most important thing is compression after surgery. So, they'll go home in a little head wrap, and then we'll transition them to a compressive garment. But really the recovery after a direct neck lift is just a couple of weeks. I'll take the stitches out after a week. There's some swelling, little bruising, but really they can go back to full activity after 3 to 4 weeks.
And then how about when you're, going back to when you're doing a face, what's your approach to a patient when they come to you and they have, concerns of neck looseness and, maybe some jowling? What's your approach? I mean, do you just focus on those areas? Walk us through kind of educating that patient on what they need to consider and what options they have for their face in general.
So I know a lot of facial plastic surgeons like to, if a patient comes in focusing on their neck, they'll point out the areas that would benefit them from having surgery, like, because the neck and the face kind of go hand in hand. And if you just rejuvenate one area, it makes the other area, it just doesn't flow. But I really like to listen to the patients and focus on what bothers them. And I focus on that, and I will offer, other suggestions in the area if they bring it up, but I don't try to point out things that patients that don't bother them. And so I will just focus on the neck if they really say, "Hey, this is what I want to focus on." That's okay to me. I don't think you have to do a face and a neck lift together on every patient.
Now I know that you love body contouring also. What are some of your kind of top cases that you love to do from a body contouring standpoint?
I do love the body, which is funny as a craniofacial surgeon. Maybe it's just because I focused on the face for so many years. It's fun to get outside of that box. But one of my favorite surgeries of all time, ever since residency, has been a good tummy tuck. I just think it's incredibly transformative. Immediate gratification. I think we all like that. But really helping women who often have the diastasis, they don't have good core strength. I just think it's really satisfying not only to give them a nice contoured abdomen, but they feel stronger after surgery. And I've even had patients who've had issues with bladder control and things like that get better after surgery. And I haven't done any research on that, but I think that it actually is a thing where people that can improve just getting their core tighter again. But I love body contouring. So after massive weight loss, arm surgery, love a good thigh lift. A spiral thigh lift is one of my favorite things to do.
Oh,
So,
nice.
mm-hmm.
Another person who's good at the spiral thigh lift. You said something that I definitely feel strongly about too, just from patients' experiences, that when people get an aesthetic procedure like an abdominoplasty where you're removing extra skin, you're giving a better shaped belly button, you're getting rid of stretch marks, getting rid of extra fat, doing liposuction and tightening their core, they do come back and they do have functional enhancement. Not like it can't be guaranteed, but almost all of them, like you say, have a stronger core. All of them have maybe better posture and gait. They have potentially relieved back pain. But this whole, urinary incontinence thing, bladder issue thing, it is, I think, a real thing. I can't guarantee it either on them, but like so many of them report that. So it's like it's really nice when you're doing something like a breast reduction too, where it's totally aesthetic, but it's functional and it's sensual also. Like we have amazing jobs, and these procedures are transformative, and they're not just, skin deep. It's like it literally can improve their function. So I think there's absolutely something there, Bill. Do you feel the same way?
Yeah, we see it all the time. Patients will come in, they won't tell us about their problems beforehand, but afterwards they're like, "Oh my God, did you realize that this, and this got better after doing the tummy tuck?" Like, yeah, that's part of it.
It's so amazing.
Yeah, and you mentioned breast reductions. I think those are some of my happiest patients. Coming from the hospital, I've done tons of breast reductions on teenagers, and I still actually see a large group of teenage patients for that surgery. And I mean, that's one of my favorite things to do, just because it is so life changing for them. Not only their back pain gets better, but these kids can be mean and they get made fun of, but they're able to wear one sports bra and be able to play soccer or whatever when they normally have to wear two. And they can find a normal bathing suit to fit into and not have to go to that custom bra store. So I love a good breast reduction as well.
Such a good surgery.
It really is. Walk us through some of the age groups, because I agree with you. We do a lot of breast reductions. I personally do a lot of breast reductions, and I hear the same thing from patients. They're like, "I'm tired of wearing two sports bras. I just want to be able to run." Or I don't really want to buy a large top and then a medium bottom. I can't find swimwear that works, right? What is your age cutoff for you, or how do you kind of talk to parents who maybe it's a 16-year-old that comes in, they're like, "Hey, you know what? I think I'm mature. I'm not 100% sure. Should I go through this now? Should I wait until later in life?" Because they're not thinking about babies at that time. They're not thinking about what life is going to look like 5-10 years from now. How do you counsel them, and what do you let them know is appropriate in regards to doing that surgery now versus waiting later?
Great question. I get that a lot from families. And so I think, first of all, it's important when I go in the room and I'm meeting the patient and they're usually a parent or two is with them. I like to see how mature the patient is, as far as like when I ask the questions, does the patient answer me, or do they look to their parents to answer for them? I think that it says a lot when the patient can speak for themselves and really does seem mature and like they've thought a lot about it. They've done research. They know exactly, what they're looking for. They can tell me what their problems are that they're trying to, fix, like their neck pain, back pain, all the things. And then I ask them, it's very important to know if they've stopped growing. So have they been in the same bra size for at least a year? I tell them if they're still actively growing, if they bought a new bra last month, then they probably need to wait to have surgery. And then I do talk to them about what it will look like if with the amount of life that's left with them. So they have potential weight changes, pregnancies. Will it impact breastfeeding? How important is it to them to breastfeed? Because not everyone can breastfeed baseline. And so, is it worth putting scars on the breast to where if you don't know if it's going to affect them or not? but I talk to them about all those things, and then I have a just very frank conversation with the parents and the patient together to see if they are ready for this and what that entails. I talk to them about the recovery, what the scars will look like, what potential complications could happen. They could have nipple sensation changes. How important is that to them? Those are things that they definitely aren't thinking about. But overall, I think it's also important to know there's not really necessarily a minimum age cutoff. I've operated on a patient as young as 12 when she had gigantomastia. It depends on how affected they are. And so would I do that right now? I don't know. I need to talk to them, but I do have the option of operating on younger kids at the hospital, which is really nice.
Jeyhan, gigantomastia, talk about like what's the max, like what are some numbers of tissue, like amount of tissue you take off of those breasts? How big are those?
So gigantomastia is different than macromastia, which is what I would say the majority of patients come in with large breasts. Gigantomastia is when the breast tissue is just totally disproportionate to what their body habitus is. And so the largest breast reduction I've done has been taken off 13 pounds of breast tissue. So I took off 7 pounds of breast from one side and 6 pounds from the other. And she was still left with probably, triple D,
Amazing.
if not larger
Wow.
breast. So imagine in that situation, the anesthesiologist actually commented that her tidal volumes changed and her pressure that it was taking to ventilate her lungs actually got better.
Wow.
As the breast tissue came off because it was so significant.
That's
because
insane.
If you think about all that pressure on the chest, like it's even hard for them to breathe at night laying on their back, but then they can't get comfortable if they sleep on their stomach or on their side. It's miserable for them.
That's insane. Jeyhan, tell us a little bit about how important your team is in providing care and achieving great outcomes.
Oh man, I love my team. I cannot tell you guys enough. I'm so lucky to have plopped down at HKB Chapel Hill, from the front desk staff throughout, like top notch. They are key to enticing people to come see us in Chapel Hill at the Chapel Hill office. But we're friendly. It happens to be an all-female staff if that's important to people. It wasn't planned that way, but it just so happens. But my nurses, my medical assistant, like I work with the same anesthesia providers that I've known since my time at the hospital. So I've known them for over 12 years now. It's literally like a family. They're not only kind people, they care about what they're doing. They care about the patient as a person, not just they don't refer to people as the breast reduction patient or the tummy tuck patient. Like they actually have names and we know their families. And I couldn't say enough good things about my team. I think they're invaluable.
Love it. Bill, what makes you happy about plastic surgery?
I love it. Oh, thanks, G. Kind of turning it around on me. I like this. For once, it's not G talking. So what I love about plastic surgery, I think working with such amazing human beings such as Dr. Wood and, sometimes yourself, but I think really making a difference in what we do with patients, i.e. like making a difference in their lives. The fact that we can adjust one body part and it changes their whole personality, their whole persona, and their whole demeanor and how they go about living their life. It's, again, I was in clinic today. I can't tell you how many times the patients came up and they're like, you changed my life. You changed my life. You changed my life. You changed my life. And it's things that sometimes we take for granted because we've been doing this for so long. Mm-hmm. It's like you said, Jeyhan, it's like, all right, we do a tummy tuck. At this point we can all do it in our sleep, but we love it. But it's so dramatic for that patient. And I like to teach some of these fellows, I'm like, listen, yeah, we do this all the time. Yeah, we might do 4 tummy tucks in this day. But realize, and my analogy is like, all right, we're like Johnny Carson, I'm aging myself, or Jay Leno, or, one of the new cats out there, the night show. They're all getting canceled anyway. But that being said, like every person is like, they need to be the spotlight, right? Because for them, this is a big event for them. They've really, planned their whole year around this procedure. And we got to focus on that one patient, that one individual, like it's everything. Yeah, you might do 4 or 5 of them a day, G, but in reality, that one patient that day, that's their everything. They planned everything around that one event. And they believed and trusted in you to be able to get it done. And I know, Jeyhan, you care about your patients just like we do. As one of the things, not only are you technically extremely gifted, but you go above and beyond and care more than any individual that I know. And I know
Thank
you
you.
personally, so I can say that. You pour your heart and soul into every patient.
I do. I really do. I get very connected. And I mean, it's also being part of, I think, the whole pediatric plastic surgery experience, like how do you not get connected with these little infants and their families that you're operating on and they're trusting you with their baby? It's a huge responsibility. And, it humbles me that I get to do those kinds of things for people. And I still have amazing relationships with families from my time at the hospital. I mean, they still reach out. It's amazing.
What defines you as a plastic surgeon, or what are your defining characteristics?
Like what you said, caring, empathetic. Um, I'm a great listener. I goal driven, skilled. I think the most important part is just I'm a caring person that I truly want to see them. I want to meet their expectations, if not exceed them, and make sure that I'm providing everything and anything that I can to make the whole journey, the surgical journey, a great experience for them. Because it's not just a one and done. I think that we as surgeons have a responsibility to our patients to be there for them throughout the entire process, however long that may take.
I think there's far and few amazing, talented surgeons who are also good, ethical people that are morally sound, that do the right thing, and they care a lot. I think that subset of individuals is not as large as people think. A lot of people can be very technically gifted, but they might not have the other qualities that are out there, and you definitely define those.
And I definitely do think, though, as I tell patients, once you we decide to do something together, you're stuck. You're stuck with me. You're stuck with us. And that's, and I think that's the thing is that I think, we have to do, it's our responsibility. They're yours. And Bill often says this, that sometimes we become their primary care docs, in some ways, because they see us more than they see a regular doc. And it's kind of crazy. I mean, the fun thing is you can tell, none of us dread coming to work. We love coming to work. We like what we're doing and the people that we're around. And so it's fun to do it. And for us, for Bill and I too, it's been so special to share that and get to do that with you. And when I got to talk to you, not too long ago, we periodically just check in and just hearing that you're happy. I love that too. I guess that's been a new focal point for my career is having other people be a part of what we're doing and being happy. And I love that. And it's even more fuel to kind of push and keep doing what we're doing because we're getting to help people, achieve their personal best and you also helping, surgeons achieve their personal best. And it's nice, just to do that on the day to day. I think that makes me happy. You know what I mean? Is patients walking in smiling after a surgery and then, your colleagues being happy also, which is, it's a different kind of satisfaction, but it's really been a special one. So thank you for sharing that with us.
Yeah. What do you see on the horizon for plastic surgery over the next year? What do you see changes being? Are you seeing trends in what patients are asking for or what you're seeing the aesthetics being?
For me, I feel like patients are starting to lean more towards natural looking results. They don't want to look like they've had anything done. They don't want to be over tightened. They don't want to be overly volumized. And so I think that we're going to slowly progress more and more to just a more natural appearance, especially with breast implants, preservé is becoming more and more popular. Really minimally invasive procedures that give the most bang, with the quickest recovery times, what people seem to be looking for.
Gee, what do you see as trends or nuances in the field of plastic surgery?
I agree. I think, there's a lot of technology out there. I think a lot of the technology that's there is just kind of reinventing itself over and over again. So it's not really iterating that much. It's kind of old plays on things that have been available. So I'm hopeful there'll be more progress in some technologies. There have been different technologies that have evolved that are getting better. Microcoring now is going to be even more advanced, and we're going to be able to do bigger areas on the body. So I think that's important for us. All of us here on this convo, we love using energy-based liposuction. We all love Renuvion. We all love Vaser. So I think those things are going to continue. But new things, I think, the regenerative space continues to be big and blowing up. And I think a lot of people use that term just kind of loosely, and no one really knows what they mean by it. So I think I think that's gonna expose itself more and more going forward, right? And maybe you can add to it because you're pretty big in that area, like how we as aesthetic surgeons are going to actually embrace and hopefully potentially control that next transition into that for the betterment of patients.
Well, I think we're on the forefront because I think we understand the aesthetics better than a lot of individuals. But we're getting in this realm now where we're learning more about genomics, right? And so we understand the genes that are associated with aging, and we're actually doing trials now for anti-aging with gene modulation, which is going to be really interesting to see what ends up happening there. We also have all these potential peptides, right? Some may be good, some may not good. We don't exactly know yet the research there, and we're waiting to see what the FDA comes down with, what's available, what isn't available to us, but can have a pretty significant impact. We already know one particular genre of peptides have changed everything in the U.S. and have been for the positive, right? People don't realize GLP-1s are a peptide, right? And these peptides have revolutionized kind of the aesthetic industry. Mm-hmm. And how many patients? Well, I'll tell you, the patients I saw today, I would probably say 70% were on GLP-1s that I saw today. Mm-hmm. And probably unbeknownst to all of us, there, a vast majority of our patients are on it. And I will tell you, in the next 6 months, my guess is over 90% of patients will end up being on some version of a GLP-1, be it either a microdose or a full version of one. And then in addition to all these other potential peptides that we have on the horizon, I think people are caring more about their health and wellness. I see that being a big push into kind of this next genre of what we do. And we're going to really hone in on our nutrition here. I think as you see kind of the trends in the U.S., we've eaten poorly as a society over the past 20, 30, 40, 50 years. And I think we're moving more towards, hey, what are we consuming? What are the nutritional values of the things that we're putting into our mouth? I think we're going to see a huge change in the direction there. It's all going to impact kind of how we look.
Yeah, and I think the only other two things that I think are going to come, and I don't know exactly how long, but it's already in the works, is that we're going to have, there's tissue engineering that's happening. There are polymers and constructs that we're going to be able to use to, for breast enhancement, where we're going to virtually get rid of implants. We're going to put a construct into a patient, and it's going to have signaling to it, and it's going to be replaced with tissue. We're going to probably use more of this other allogeneic substitutes, like, there's products like Renuva, there's products like AlloClay, which are, cadaver fat constructs that are really interesting, that are going to get better and better. And the other thing that we're just starting to embrace in the U.S. and a couple states is, use of stem cells, cord blood derived stem cells versus, bone marrow ones. And it's kind of the wild, wild west right now, but I think there's going to be an interplay of all of that with the aesthetic sector. And I think we just need to be aware of it and obviously only do things that are safe for our patients. But it'll be great. And one day I think we'll be able to do scarless surgery, but we're far away from it, but hopefully we will one day.
Do you think we're going to be replaced by robots? If you ask Elon, he said 3 years.
What do you think, Jeyhan?
Your job is going to be obsolete.
Absolutely not. Would never trust a robot.
I'd have a robot assist me.
I 100% will tell you, I think we're going to end up having first assistants as robots will be our first assistants. There's no doubt in my mind, and it'll probably be in the next few years. Them taking over my job, maybe in the future, but they have to be trained. And who's going to train them?
After we're retired.
Right? So like the only way they can get that, somebody would have to train them.
We'll see.
I think we can protect our space here with the robot thing. They're paying housekeepers to wear cameras
to watch
their activity so they can train robots, right? So in essence, right, they're going to be able to take footage from what we do to train surgery. So again, it's all about protecting the space and doing it the right way. Now, if there's a better way to take care of patients, I'm all for it, right? I think we all would be, right? I think if there's a zero complication, if there is a way to have AI or robots help to have a zero complication procedure, I'm all in on that.
Well, I think the thing is, though, is, if you guys have probably all used like DaVinci, gotten under there and played with it and used it. I mean, once you get to where you can use it and you use that, that's robot assist. But if there's a robot performing a task, a mechanical task that has to be done over and over again, there's no doubt that robot is going to do it every time to a level that you or I could never match. So I mean, there's probably a place for this in surgery, like all day long. I'm not saying that they could maybe make the kind of artistic kind of decisions and the marking and planning and doing all this stuff, but who knows what's gonna be available, you know?
I think we'll use them as assistants. There's no doubt in my mind. I think for sure we'll have them as assistants.
But there could be a thing where you could have the robot, and more for like functional surgical interventions, like in the Amazon or somewhere, like, and you have to, like, someone has an emergency, there probably could be a remotely driven robot doing the surgery, you know, and having like a little somebody there, like they do with, you know, like the Da Vinci system. But we'll see. I mean, the way things have progressed, something's going to happen, and it'll probably be part of surgical care, one way or another.
TBD.
Maybe at HKB, we'll have some robot assistants.
I'd love to get a robot that had G's hair on it. That'd be great.
I just have that robot. I just want a robot to, like, I'm trying to think what a robot would do here for us. I have a robot just running around picking me up healthy food. All right. Well, Jeyhan, this has been an amazing time talking to you.
We got to have you back on.
Thanks, guys.
We
Would love
appreciate
to.
you so much. And I'm sure all the listeners will get a lot out of this. And if they have any questions or comments, they'll reach out.
Perfect. Thanks, guys.
Thank you. Thank you for listening to HKB Uncut. If you enjoyed this episode, please subscribe to us on Apple, Spotify, or YouTube.
To book a surgery consultation or med spa appointment with our team, visit our website at hkbsurgery.com or head to the links in our show notes.